Okay, so if you're a new parent, you know that feeling, right? You see an unusual little mark on your baby's skin and your mind just starts racing. But what if I told you that most of the time these marks are part of a totally predictable and temporary story? Today, we're diving into the most common type of birthmark out there, the pediatric vascular tumor.
You've probably heard of them or even seen one. People call them strawberry marks, because they can be bright red and a little bit raised. And if you've seen one, well, you're definitely not alone. They are incredibly common.
Just how common? Well, about 4 to 5% of all infants get one. So yeah, if you've spotted one on your little one, it's good to know that it's a shared experience for so many parents out there.
The official medical name for it is an infantile hemangioma. And here's the most important word on this slide: benign. That means it is absolutely not cancerous. It's just a little collection of extra blood vessel cells, and it happens to be the most common benign tumor we see in babies.
What's so fascinating about these things is that they follow a super predictable path. Seriously, you can almost set your watch by it. So let's stop thinking of it as a scary medical condition and start seeing it for what it is: a little biological journey with a clear beginning, a middle, and an end. So what does that journey look like?
The whole process is remarkably consistent. First, it usually pops up a few weeks after birth. It might just start as a pale little spot, or maybe look like a tiny bruise. Then, for the first 5 months or so, it hits a rapid growth spurt. This is when it gets that classic strawberry look and does about 80% of its growing. But then, right around the first birthday, the script totally flips. The tumor starts to soften up, it shrinks, and that bright red color begins to fade out. And for the vast majority of kids, by the time they're about 4 years old, the mark has pretty much vanished all on its own.
So while that predictable journey is the story for almost all of these marks, some have let's call it a small twist in the plot. It's not common, but it's really important for parents to know when to pay a little closer attention.
For most cases, the doctor's approach is actually pretty simple. Just keep an eye on it. This quote really says it all. The key thing to remember, and this comes straight from medical experts, is that parents can be reassured. Just watching and waiting is usually all that's needed.
So what kind of complication are we even talking about here? Well, have a look. A huge 84% of these marks have no complications at all. 0. The most common issue, by far, is something called ulceration, which is just a fancy word for the skin on the surface breaking down a bit. This happens in about 16% of cases, and it's a bit more likely in places where there's friction, like on the lips, the neck, or in those cute little baby skin folds.
But what if it's not small? What if it's really large, or it shows up in a very specific place on the body? This is where this story gets a little more complex, and where the mark is becomes just as important as what it is.
For instance, a large hemangioma on a baby's face, particularly in girls, can sometimes be a red flag for a rare condition called PHACES syndrome, and that can be linked to other things going on with the brain, heart, or eyes. This is exactly why a big facial mark isn't just a skin thing. It's a critical signal that you need to get a full workup from a team of specialists.
And it's the same idea for a large one on the lower back. It can be a sign of something called lumbar syndrome, and that comes with about a 1 in 3 chance of there being an issue with the spine underneath. This is why a doctor might order an MRI to get a clear look at what's happening below the surface.
Now let's talk about those cases that do need some help, because the story of how we treat them has gone through an incredible revolution. We've literally gone from a passive, wait-and-see mindset to a highly effective, active one. The old way? It involved using systemic corticosteroids. And yeah, they came with a ton of side effects and, get this, we're never even officially FDA approved for this. The new way is a total game changer. It's a beta blocker called propranolol. And today, it's the go-to first-line therapy because it's not only way more effective, it's also much, much safer. Just how effective are we talking? Well, a huge clinical trial gave us the answer, and it's pretty stunning. After just 5 weeks, babies treated with propranolol showed an 88% improvement. The placebo group? Just 5%. I mean, those numbers really do speak for themselves. It's night and day.
So how does this stuff work its magic? Well, it's basically a 3-pronged attack. First, it physically tightens the blood vessels inside the tumor. Second, it cuts off the chemical signals that are telling the tumor to keep growing. And third, it actually tells the tumor cells to, self-destruct. It's an incredibly smart and targeted approach.
Okay, so to wrap this all up, it's really important to remember that while infantile hemangiomas are the headliner, they're not the only act in the show. Not all red marks are the same, and knowing the difference is everything when it comes to getting the right diagnosis.
The main one that gets confused is the congenital hemangioma, and the biggest difference between them is all about timing. A congenital one is there, fully formed at birth. The infantile ones we've been talking about show up a few weeks after birth and then they grow. And on a microscopic level, they're different too. Infantile ones have a protein marker called GLUT1, which is a dead giveaway for doctors.
And just so you have the full picture, there are a couple of other rare ones. You might hear about a pyogenic granuloma. It's this little red bump that tends to bleed really easily and usually shows up in older kids. And then there's this super rare Kaposiform Hemangioendothelioma. That one's a more aggressive tumor that definitely needs specialized care. This is why getting an expert diagnosis is so crucial. All right, let's just quickly run through the main takeaways. Number 1, most of those strawberry marks are totally harmless and they just go away on their own. 2, their life cycle is a predictable story. They appear, they grow, and then they shrink. 3, location, location, location. Big marks on the face or lower back mean you need to see a specialist. And finally, for those few cases that need treatment, we now have options that are a true game changer.
And that really leaves us with one final thought. This whole story of moving from just nervously waiting to being able to confidently and safely step in, it's like a perfect little snapshot of medical progress. It really makes you wonder, right? As we get even better at this stuff, how is it going to change what we even consider a problem in pediatrics in the future?